Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
This is Susan Kaufman. I'm here for Attitude Magazine. You're listening to our Attitude Magazine ADHD Experts session. Today we have the pleasure to have Dr. Mary Solanto, Ph.D., our guest speaker. She's speaking about cognitive behavior therapy and how it can help ADHD adults, specifically with executive functions such as time management, planning, organizing, and prioritizing. Dr. Solanto is associated with the Mount Sinai Hospital in New York City and its Center for Excellence for ADHD and Related Disorders. She's the author of a treatment manual for therapists entitled Cognitive Behavioral Treatment of Adult ADHD, Targeting Executive Dysfunction. It was published by Guilford Press in 2011. She'll talk more about her book later, which has proven to be useful by individuals as well as therapists. With that, let me turn it over to Dr. Solanto with our thanks. We appreciate so much your being here today.
Thank you. It's really a pleasure to be here and to address this topic. So, I think CBT has generated a lot of interest, but also I think potentially a lot of confusion. So, I think it's important to kind of understand what CBT is and then how specifically it's been applied to ADHD. So cognitive behavior therapy is an umbrella term, really, for a group of interventions that are specific to different disorders, to depression, to anxiety, different kinds of anxiety, to PTSD, OCD, and now specifically to ADHD. The way cognitive behavior therapy is used for each of those conditions varies. But what they all have in common is that the focus is on cognitions or thoughts and behaviors in the here and now. So when this was first introduced 50 years ago to the year by Aaron Beck, this was a major departure from the way psychotherapy had operated until that time, with the emphasis being on the psychoanalytic perspective and the belief that one could really only address current problems by delving into the individual's past, the developmental history, family history, and so on, where presumably these problems originated. So as I described, it's been refined for other specific conditions. This is a little bit, maybe it would be easier if you, okay. So another advantage of the cognitive behavior approach, in addition to only requiring that a person get in touch with thoughts and feelings in the present and learn methods of modifying those when they are dysfunctional, because thoughts and behaviors can be observed and recorded, it means that these interventions can be tested for efficacy. So we can actually collect data on how people are performing or functioning before treatment and after treatment to know whether or not this treatment is really having a significant effect. And the CBT approaches that I've described have all now an evidence base to show that they are effective. So how is CBT relevant for adults with ADHD? Initially, there weren't any CBT. In fact, until only the last few years, there wasn't any psychosocial treatment at all, really, that had been developed and shown to be effective in adults with ADHD. There had been clinical case series, but not a fully worked out intervention that had been demonstrated to be effective. And we have that now. The way that CBT works for adults with ADHD is to address both cognitions and behaviors, as in any other CBT program. The cognitions that we are addressing in this intervention are the way that people think, the self-instructions they give about when and how to begin a task, whether or not or when to prioritize, how to organize, how to plan. So a thought might be, I have something to do, but I know I can do that later. I have plenty of time to do that. Versus, well, let me make a plan to do this, or let me look at what's involved so I know when to start it so that I will have enough time to finish it before the deadline. So those are different kinds of thoughts that a person can have in that situation. And you can see that there are differences in terms of how effective and functional they may be. So then we also address behaviors. Which are skills and habits connected to those skills. So one foundational skill is using a planner, but a habit connected with that is checking it regularly, because of course having a planner isn't going to be helpful unless you do that. So there has to be a habit that's developed alongside that. Another example might be setting up a filing system. So one can learn how to do that, but of course there has to be a behavior connected with it, a habit, which is putting things back in the files after you take them out. So it's important to address both these aspects. Another way that CBT is relevant for adults with ADHD, it relates to the fact that many adults with ADHD, by virtue of their experiences, also have coexisting anxiety and or depression, a high percentage. So we have found that it's important to address those issues too. And here we borrow from those classic kinds of intervention that were developed beginning with Beck and then others that specifically address the kinds of cognitions that generate problems for people in the areas of depression and anxiety. An example might be you find you made a mistake, or somebody tells you about a mistake you made, maybe your boss, and you think, I never do anything right. Well, that thought we could characterize as an overgeneralization. It's an expansion of what actually happened. But that kind of expansion can lead to feelings of depression. You know, I'm hopeless. It predicts, in fact, that I'm not going to ever do anything right. And that, of course, can lead to feelings not only of depression, but anxiety as well. So we've incorporated some of those approaches into our approach with our CBT with adults with ADHD. So one question is, well, how does this intervention, how does CBT compare to medication for the treatment of adults who have ADHD? We have not had any direct head-to-head comparisons yet. Those are studies that need to be done. Our clinical experience, though, suggests that these interventions do different things. That medication is best for basic attentional functions, for helping people to reduce distractibility, selectively attend to what's important, and to prolong their attention span. It's also helpful in improving impulse control. On the other hand, CBT is probably best for executive functions, for learning how to manage time, to organize and plan. So to quote one gentleman who very pithily remarked that medication helped him focus, but it didn't tell him what to focus on. So today I thought I would review a couple of the components of our program just to give you a flavor of how it works. So, you know, as I mentioned, one of the things that we begin talking about is the importance, really the necessity of using a planner to record not only one's appointments but also one's tasks, whatever you intend to accomplish during the day. And we have related to that 4 commandments of planner use. So, because they really are so fundamental that it's really virtually impossible to be organized unless you have one. And you may only have one. You know, everything needs to be in one place. There are lots of problems that evolve if you try to keep separate planners, particularly separate planners for home and office. You need to enter all of your tasks and all of your appointments into the planner. Everything goes into that place, which means that you need to have it with you all the time, because you may be out on the street, you see someone, you want to make an arrangement for lunch, you want to put that directly in your planner. You don't want to, you know, jot it down on a Post-it and stuff it in your bag and then possibly not find it again. None of this would be any help at all if you don't reference the planner regularly. And we suggest that it be done 3 times a day. In the evening, so that you know what's coming up the next morning, which may affect what time you have to get up, what you have to wear, what you will have with you, what you have to prepare, and so on. So it's important the night before to know what you're going to be dealing with in the morning. And then, of course, you on the way to work, for example, or perhaps before that, over breakfast, coffee, you want to look at your planner to see what's coming up. You want to see how your day is going to evolve. You want to start to get into that mental groove of being prepared to anticipate and deal with whatever problems or tasks you're going to have to undertake. And then the third time it needs to be checked is in the middle of the day. Why? Because, well, we know that mornings often don't evolve as we had planned. In fact, probably most of the time they don't. New things intervene, other issues arise. You may have had to defer some things that you had planned to do, which means not that all is lost, but that you might need to rearrange your afternoon. Some things may have to go by the wayside. Other things may have assumed a greater priority. So that's why one needs to consult one's planner in the middle of the day to see what's upcoming for the afternoon and evening. So we have mantras that we repeat at, I think that's still on the slide here, intervals. There it is. Throughout the program, and the one related to this is, if it is not in the planner, it doesn't exist. And that simply means that if you haven't allocated a time, a specific time to do this thing, very likely it's not going to get done. It's going to kind of remain in your imagination. That it's so important to really allocate time, both so that you remember to do it and so that you have the time to actually do it. Another important skill that we found people find very helpful is to break down complex or aversive tasks into manageable parts. We've done research on the components of our treatment, and this is what people consistently say is the most helpful skill. So, for example, you have a report to write, and that involves maybe doing some research, looking up some references. Then you have to outline it. You have to write a rough draft. You have to go back and do editing. So each of these involve components. And often, I think people with ADHD feel very intimidated when confronted with a project like this that seems overwhelming, that includes things that they may not find congenial. And for this and any other task that seems overwhelming in that respect, it's so important and so helpful to break it down. So the first part might just be, just reading through the literature or reading some references to see what's available. So there's no pressure at that point to begin to produce. In fact, it might be kind of interesting to kind of explore what's there. So you set aside time to do that. Then the next step might be, even before you create an outline, to jot down, or maybe even as you're reading, to jot down some thoughts, some ideas, in any order, just to kind of get them out there, to brainstorm. The next step would be, see if you can get them in some kind of order that would make sense in terms of how they'd be presented in the report. Then the next would be to kind of write a rough draft, and so on. So that turns out to be much more manageable. Another way of doing this might be, let's say you have a pile of papers on your desk, and sorting papers is the worst thing in the world for you, and you've decided, I'm going to devote the morning to doing this. And then it's 10:30 and you still haven't started. Okay, that's your cue that you need to break down this task. Obviously, it's something that you want to avoid, so how can you deal with it? You can deal with it by breaking down the amount. I'm going to just do half of these papers now and half later. Or you can break it down by time. I was going to spend 3 hours doing this, but, clearly that's too much. I can't digest that. So you break it down. You break it down to, let's say, 2 hours. You find you're still not getting started. The time is passing. Okay, break it down smaller, 1 hour. Half hour, 15 minutes, whatever you can tolerate. It's so important to break things down either by quantity or by time to the smallest amount that will allow you to get started. And this helps to counteract this all or nothing tendency. I do it all and clean up everything, clean up the whole room, the whole desk, or you don't confront it at all. And very often it's the latter. There may be bursts of energy where you do everything, but it's not consistent, and we know about the difficulties connected with that. So our mantra for this particular skill is, if I am aware that I am having trouble getting started, time is passing, I said I was going to start and I didn't, then it's inevitable that the first step that you were planning to do is too big. So that tells you you need to break it down. Another topic that we address is prioritization. Why is it important to prioritize, first of all? Well, for all of us, time is limited, and if you don't do things in the order of importance, there is a strong possibility that you're not going to get to something important. The time will run out before you get to that important thing on the list, so you have to do that first. And we find that prioritizing is especially important for people with ADHD, because unless they do that, they're very likely to go with the impulse of the moment, what seems to be most pressing at the moment. Somebody calls you about something you need to do, so you shift to that. Or you get a thought about something else maybe that's more interesting than the important thing, and you shift to that. And so this provides a roadmap to the day so that you can kind of visualize your goal and, in particular, know what you will feel good about having accomplished at the end of that day. That's really your goal, because in your heart of hearts, you know what's important. We have ways to help people consider the priorities. This we actually borrowed from Stephen Covey, which we've done with permission from his work, but it's an urgency importance matrix. We have things along the top, urgent and not urgent, and we have things that are important and not important. Important and urgent, maybe most of us will deal with. Your child is sick, you've got to leave work and take care of them. You're going to Europe, and this is the last day that you can apply for a passport. There's some sort of, or there's a report that, has a drop deadline of, next week, can't get around it, would be major consequences if you didn't have it finished, and so on. The trouble is, if people with ADHD often wait until things become urgent before they begin or really move ahead on those. So what they tend to neglect are things over in the box labeled Roman numeral 2 that are important but not urgent. So beginning that report in enough time to finish it without having to pull all-nighters, or making a plan, making reservations, working out if a student has to finish a term paper, to plan it and begin it before it becomes urgent. Otherwise, what happens is that ultimately, eventually, those important but not urgent things will become urgent. Things in Roman numeral 2, in box 2, will move over to box 1, and then you will find yourself continually putting out fires as the urgent items arise. And of course, we know that's very stressful and comfortable and leads to suboptimal results. So this is a prioritization worksheet that is part of a home exercise for one of the sessions. So here we ask people to list the tasks that they want to accomplish in a given day, for example. Identify whether or not there's a deadline, identify how much time they think they will need, and then to rank order them in terms of priority. When they're all listed there, it's much easier to identify what's the most important. Okay, so this item is clearly the most important, that gets to number 1. Okay, then this one is next in importance, and so on. And that gives you a kind of roadmap for how you're going to plan and approach your day.
Okay, that was a great introduction, Mary. Thank you. I want to follow up on the planner question. Time management being one of the primary topics of this session. A number of people have posted, and I have to say that I've had this experience myself, and I can identify that it's very difficult to settle on a planner. They try multiple planners. They use one, they try a different one.
Right.
They have a hard time going through the planners. That's one part of my question. The other part is paper versus electronic. I myself have converted entirely to keeping lists of things to do on my phone and keeping lists on my computer screen. And others on the webinar have asked the question, what if the phone is the way you organize or electronics is the way you organize? And I guess part 3 of the planner question, do you recommend any specifically friendly ADHD print or electronic planners? Okay. So I think it's important to bear in mind that no planner is going to be perfect, and I think sometimes there's a tendency to change planners because you realize you're not being efficient and you kind of blame it on the planner, rather than the need to develop good habits around the planner, and to recognize that it is going to be a little bit tedious to always have to enter everything. So I think it's important to recognize that and not switch planners just because you find it tedious. But given that, I think whether or not one uses a digital planner or a paper planner really depends on your comfort level using digital media. Either one can serve the purpose as long as it has certain characteristics. So
The planner needs to have a place not only for your appointments, and which are ordered by time, of course, but also a place to keep your tasks, and your tasks organized by category. You don't want a task list that contains everything that you need to do, that you have to buy milk, that you have to complete a memo, you have to buy something for your child. That isn't going to be particularly helpful. But most of the planners, both the paper and the digital, allow you to organize your list by categories. So the things home repairs, things to take care of at home, things you have to buy at the department store, calls you have to make at work. And if you might even need to divide your work lists according to client. For client A, you need to do this. For client B, or project A or project B. So you want things available already clustered so that when it is time to turn to project A, all you need to do is open that task list and you'll see what needs to be done there. Among paper planners, Filofax, I think they're still available, is helpful because it's a ring binder and you can remove all of the calendar for a particular year and insert new pages, keeping your contacts, which should also be in the same place. You don't have to copy over your contacts. And it also has tabbed sections at the back that you can label and use for your various projects. So you can have the red tab represents things to do at home, and the blue tab, things to do at work, and so on. There's another paper planner that is useful. In fact, it was described in a magazine for people with ADHD, may even have been Attitude, that it's called Planner Pad, and you can get it online. And that incorporates these features, that it has enough space for you to indicate not only your schedule, but also to keep track of your tasks and what you've accomplished. So that's the essential feature. If you get a digital planner, you want it to be able to sync with whatever task manager you are using. The Outlook has a task manager, but I don't find that particularly easy or helpful to use. There's another one called List and Do, L-I-S-T-N, the letter N, D-O.com, that can sync. It syncs with the Google Calendar. I think through that it can sync with the iPhone, but it's possible to get it to sync with the iPhone. And the advantage of that is you enter the task in your list. If you indicate a deadline for it, it will show up in your calendar automatically. And that's what you really want to have, because as I said, if it's not in the planner, it doesn't exist. You want to put your tasks, the projects that you need to work on in your planner, allocating time for that. And this makes that easier to do.
We have a couple of suggestions from people on the webinar, I think helpful ones. A recommendation for Remember the Milk, an app which does sync with the Google Calendar, as well as, and this app has come up before, 30-30, a timer app. So people on the webinar, we have had previous sessions specifically on apps, one more recently, and some of those are on our website. So, but I do think that finding the right digital or paper planner is a trick. And I will say that for myself, I literally, and I'm embarrassed to say this, I literally become bored with the planner I'm using and switch to a different one.
Right.
I mean, there's no question that I need to have it, but I can't sustain necessarily the same method for what that's worth.
We're hoping that maybe people could learn to find their thrills in other places.
Yeah, I know, you're absolutely right.
It does mean
planners.
starting over again. And, maybe means, okay, it's a boring thing, but it's going to be boring really no matter what method you use. There, some thrills.
It's not so much that it's boring as that it stops working as an organizing tool. I mean, in any event, in terms of organization, another question that comes up from people is avoiding organizing a desk or an office to avoid distractions. I think that's a good question. In terms, and also, what do you think of the concept of writing every single task, the sort of David Allen, everything that's in your mind, getting it on a piece of paper?
So insofar as avoiding distraction, so at your desk or whatever workplace you have. The mantra there is, out of sight, out of mind, in sight, in mind. So there are things that you don't want to be thinking about when you're working at your desk. So you don't want to have those in your field of vision. You don't want to have, the latest People magazine or the newspaper, or you might even actually need to cut yourself off from internet sites that you tend to frequent. And there are programs that will allow you to do that, to shut off or make access to those sites very difficult, particularly or impossible, for a period of time. And so that's a way of kind of preserving your focus on task. It's a kind of a preventive intervention. And then you want to have things that are fully in your face that are the things you need to do. And that's where I think having a calendar that can appear on your screen for that day, the agenda for the day, is very helpful. So you want something that you can view on your desktop as well as your iPhone. And then you want to have things within easy reach that you need to use or access when you're doing a particular job. So you want in the desk drawer that's nearest to you the files that pertain to the things that you're working on now. Move other things out so that things are easy to hand. It's hard enough to get started with some of these tasks, but if you have to go searching for things and potentially get distracted by other things that are not relevant, it's more challenging.
Okay.
The idea of writing everything down, I think when you think of, let's say you're providing service to customer A, and you think of something you need to call them about, I think you should write down customer A and, make call regarding such and such. I think it's best to capture all those things. You wouldn't necessarily enter all those individual tasks in your planner. In your planner, you might just have allocated time to, deal with customer A or project A. And then at that point, you can seamlessly open the list that syncs to see what specifically you need to do for that person or project.
Okay. Moving on to another topic that's come up frequently in the posted questions. Being late, time management. So we've talked now about organizing your tasks. A second executive function skill that many people have posted about, and some very poignant posts. One from someone who says, I'm a mental health professional. I've worked in private practice with clients for 15 years. I'm having increasing difficulty being on time for clients. It's really destroying my practice and my livelihood. And she's deeply shamed and embarrassed, which people mention frequently about just not being able to be on time.
And that, it is important to be able to be on time. It's important for relationships. It's important for professional functioning. I've known that people who lost jobs because they didn't arrive in a timely manner. So, how to deal with this? Well, there's some things you should know about your own schedule that will allow you to plan. So if the issue is getting to work on time, you need to be very clear by measuring it. We have people do this in one of the sessions, kind of keeping how long does it take you to get ready to leave the house from the time you get up? What is that time interval? You need, and over time, it's probably, pretty consistent for any person. And what is the time that you need from the time you leave the house until you arrive at work or school, or whatever? So, and then it's important not to choose the minimal time. That if the train was waiting at the platform when you got there, and there were no delays, and we know that is probably not typical. You want to know kind of the average amount of time, and if it's very important to be on time, you want to know what's the most amount of time that it could take you. So then you know what time you have to get up, so know what time you leave the house in order to get to the office on time. Now, I've noticed that sometimes people are reluctant to err on the side of being early because, well, that would be so boring. What would I do? Waiting is, anguish. And so I think subconsciously that may operate so that people really avoid being early, even if it would be better to allow that amount of time because they don't want to have to wait. So I think it may be helpful in that situation to always have something with you that you could do. Maybe something you don't get to do much. Read the newspaper, respond to emails, read a magazine, a book, so that you don't feel like you're going to be kind of just hanging out waiting.
So interesting you say that, because someone named Mia has posted that she has found tricks to use to get herself to be on time, which include only allowing herself to use her phone once she gets to the destination,
Yes. Yeah.
having something with her that she knows she'd like to do that she's allowed to read or play only once she's there and parked.
That's
It's interesting.
great.
So she's created sort of motivational techniques. Is that something you recommend?
Yes, absolutely. And here is where know thyself is so helpful. So if you find that you're having trouble leaving the house, what are you doing that's delaying you? I worked with one gentleman who had his own business, so he could kind of get to the office anytime he chose, but he really wanted to get there early to attend to things, and he was very frustrated with the fact that he couldn't make that transition. And, as we explored, we found out, he would sit down and start doing email on his computer at home, and we know what that can lead to. He was dealing with, so the rule that we needed to develop for him was that he can't even turn on that computer. It would just be too tempting, and once he got started, it'd be very hard to stop. So, and we further realized that he needed to close the door to that room so that he even get the sight of the computer that might tempt him or awaken the impulse to do those things. So, as the listener described, you need to know where your temptations are and what you're going to have a hard time stopping, so that you don't even start them in situations where it would be, unproductive to do so.
Interesting, very interesting. I want to turn to the emotional side of ADHD.
Sure.
One of the things that we found over the course of these sessions over the last year is it really resonates with the people who tune in when they feel understood. And one of the things that's come up frequently is that people with ADHD are tremendously sensitive, and sensitive to criticism. And a couple of people have asked about how cognitive behavior therapy fits in to either anxiety, depression, or what they feel is an excessive concern with how they're viewed by other people. Sort of almost an obsessive feeling that they need to please people around them.
Right. So that certainly is a very important dimension of the experience of people with ADHD. That's where we would draw upon the kinds of interventions, or the kind of CBT specifically, that has been used to help people around feelings of anxiety or, rejection, that relate to feelings of depression, those kinds of uncomfortable emotions. So, for example, if she was a sensitivity to criticism, so, which might be that your boss, makes a comment about something you've written, and you may kind of jump from that, oh, he really hated it. Oh, I must have done a terrible job. He doesn't appreciate my work. But it may have really been the case that there was just one comment, and that one is overlooking the positive comments. We call that, selective attention, or disqualifying the positive. And it would be important to become aware of that and say, okay, he didn't really criticize the whole thing. This kind of dialogue can be done in a group setting as we do, but, in one-to-one with a therapist, to kind of look at that conclusion and whether it's really borne out by the facts. And if he did make one comment, is there some utility in looking at that? Because, it's only with feedback that we can grow and change, too. So maybe there would be something helpful. But it doesn't necessarily mean that he, didn't like your work. So another way to address those is through mindfulness. So this allows one to become aware of the emotions that one is experiencing in specific situations, so that they can be discussed, brought forth, examined, and you don't need to necessarily act on them. You can kind of be aware of the thought, look at it, see whether it's really reality-based, whether it's helpful for you to think that, other ways that you can respond that would be, helpful and self-encouraging. So, yeah, it's definitely important to include those kinds of approaches in the treatment.
So you do find then, this is a question from someone, that CBT can be used for depression and anxiety?
Well, again, there have been specific programs developed to treat depression. I mean, these are programs that are very well manualized. There are treatment manuals for therapists to use. They've been shown to be effective, and they are specific to different conditions. So not only is there one for depression, there's one for generalized anxiety, for social anxiety, performance anxiety, OCD, and so on. So there are whole programs just to help people with each of these facets. So we try to incorporate some of those as is helpful in our intervention, but it may not be enough to fully address those problems. It's really more of an introduction. And I think you can only focus on so many things at once. So maybe sequentially one would go through a program directed to executive function, another directed toward anxiety, for example. These are all habits that can't be changed overnight. They all require practice, developing awareness, challenging the negative beliefs, and so on. There is no kind of fast or quick method to address these.
Okay. So it sounds like what it would be helpful to people is to have a cognitive behavior therapist. Mm-hmm. And in fact, many people are asking, is it possible to set up a cognitive behavior therapy on their own? Mm-hmm. If not, how do they find a cognitive behavior therapist? Can we talk for a minute about
Sure.
that?
So there is a professional association of people who do cognitive behavior therapy. It's called ABCT, Association for Behavior and Cognitive Therapies. It's at abct.org. And they have a listing there of therapists who practice in that modality. It doesn't necessarily mean, though, that they have any specialization in ADHD. And, I have to say there are very few people who have that. I mean, we just manualized our program and published it, 2-3 years ago. We've done a training of therapists since then, workshops and so on, but this has certainly not permeated the therapeutic community. So it might be helpful to identify a therapist who is generally comfortable with this approach to treatment that focuses on cognitions and behaviors in a very kind of systematic and deliberate way, who is open to kind of using that method to apply to ADHD, perhaps being guided by the therapy manual that we published. So that's a possibility if you can't identify someone who specifically has this expertise.
Can you repeat the name of the association again of cognitive behavior therapists?
Yeah, it's the letters ABCT, which stands for the Association of Behavioral and Cognitive Therapies. abct.org is where you would find.
And again, the name of your manual for therapists.
If you just go to the Guilford site, Guilford Press, you just enter my last name and it'll come up.
Okay. I think Mary's suggestion is that if you have a therapist who's open to learning about CBT techniques for ADHD people, they might find her book very helpful. abct.org. Someone says not working.
No,
someone
really?
else says try abctcentral.org. So, okay. How young would you recommend cognitive behavior therapy's effectiveness? There are a number of questions about people's children, adolescents. Is cognitive behavior therapy useful? And at what ages does it be useful?
Again, it depends on what the target problem is. So there have been therapies that have been shown to be effective, cognitive behavior therapies, for children with anxiety, for example. And there are published guides to that. Anne-Marie Albano, for example, has one. And so that can be helpful. I'm not sure if there's one for depression. For depression in kids, I'm not sure. Mindfulness is beginning to be adapted for children. There have been efforts over the years to apply cognitive behavior therapy to children with ADHD or to adapt CBT methods for them. And those, for the most part, were not successful.
Okay.
more recently, an approach has been developed by the people at NYU, Harvard Abacoff, where it combines some behavior therapy, meaning some intervention by the parent or teacher, and some elements of cognitive behavioral self-talk to help kids with ADHD be more organized. So I think that's what has the strongest evidence base now for children. It won't necessarily, in fact, it's not even designed to address general problems of paying attention and focusing and attention span. It's really to help kids become more aware of time, what they have to do when, to have the materials with them that they need, to know how to approach their homework, those sorts of issues.
Okay.
These are great questions.
Yeah. Is the person wondering whether procrastinating and then rushing to deadline is some kind of a addiction that ADDers might have, just loving that last minute rush, that cortisone release is how he's describing it.
Right.
Sort of pulling it off on time is a reason for being late.
I think that really does describe what happens in a lot of situations. In fact, my colleague Russ Ramsey has called it brinksmanship.
Yeah.
So it's like you're playing a game with yourself or seeing how close you can cut it and still carry it off. That may have been kind of making a virtue of a necessity because, as a kid, maybe that was the only way you could do things, but you felt pretty proud of the fact that you were able to do it, despite everybody else's cautions, and pull it off. And, people who are bright may be able to do that. And I think maybe then that habit kind of persists into adulthood. And there is this certain idea of this little challenge here that probably does get, the norepinephrine and dopamine flowing, activates those regions so that people kind of thrive that way, or they assume that that's the only way they can do things.
Right.
The trouble with that is, of course, that over time, that's a stressful way, and, it may not always work when there are things that just require more time. So as you become, if you have more responsibilities in the business world, for example, it may not be possible to do that anymore. Mm-hmm. And one has to be aware, okay, well, again, one's going to have to get one's kicks and throws in a different way, because that is
not changing planners, right?
Right.
Here's a couple of sort of related questions. One person, Kendall, says, why is it easier to get stuff done when I'm busy and impossible to get anything done when I have little on my plate?
Mm-hmm.
And then the next person says, even when I try to make a plan and break down the tasks, I can only get stuff done on impulse. Mm-hmm. If I try to follow the list and not impulses, I just get nothing done. Mm-hmm. So there's sort of this sort of bipolar, getting a huge amount done or getting nothing done, this kind of schism that people with ADHD tend to experience. What's going on there, and how can CBT help?
Right. So this is a phenomenon that we hear about often. Why is it easier to get things done when you're busy? Well, I think that you're probably in the mode of recognizing that time is limited, and if you need to be working if you're going to get these things done. If you have few things, you may feel, well, I have nothing else. I can do this tomorrow, next week. It doesn't really matter. And I think when you say that to yourself, I can get things done whenever, it often means not ever, because you kind of assume you don't need to make a plan, that the time will always be there. So again, the antidote is to still decide on a certain time and plan to do it, and not kind of go on with that implicit notion that time is infinite and you can continue to do this anytime. Time is still passing. So I think it's still important to schedule yourself to do things. And then if it's hard to get started on those things when the time comes, I think, maybe breaking down the task into the easier parts, beginning with an aspect that's more interesting, enjoyable, because so often the issue is getting started. That is often the hardest part. And people often find once they start, and it might be starting with as little as just reading through what you need to do, just looking at it, and not even expecting they're going to start right away, but just becoming aware. People often find that once they do that, they get over that hurdle of just initiating the task, that they can get into it. They may find out it's not as difficult as they thought it would be. They begin to see results. They begin to have the relief of knowing that they're moving ahead. So all these things can help perpetuate the effort once they finally get started. There's an old Irish proverb that translates to a good start is half the work.
Right. We have Jonathan on the line who is the author of ADD and Romance, and he suggests a technique. Says hello, a technique in which you start for 15 minutes and you try to do something for 15 minutes, and then maybe a second 15 minutes, and usually at that point you're past the hurdle of getting started.
That's a very good way to do it too. So you're breaking it down to the amount of time you're going to spend. And you can say, I can do anything for 15 minutes, right? You can say that to yourself. Or I can do anything for 10 minutes, just to be aware of that. And that can also help you get into it.
Yeah. Another trick that I use, I don't know if this is anything to do with cognitive behavior therapy, but if I have a really big project that's really important to me, I just try to make sure that every single day I do at least one thing, however small, that is on the critical path to that project.
Exactly. So you know that if you keep doing that, you will get to the end.
Day after day, right?
Yeah.
Well, let's go back to this question that I mentioned early on about budgeting. I think this is a huge problem for people with ADHD.
Budgeting money or time?
Yeah, budgeting money. Creating a financial planning system, keeping to it. It's got all the components of what we ADHDers hate. And the person who's asking about it says, she and her husband both have ADHD. They have tried repeatedly to set up a budget, and they just don't seem to be able to implement it. They write it down and then nothing happens. They don't follow it. I mean, what's your experience with financial management and your advice on financial management?
We don't address that directly, but I think it would be important to know, where does it go wrong? What is there impulse buying going on? What is the impulse buying? What triggers that? Is that when you go to, you're passing a certain store and you start window shopping and you get the idea to go in and purchase something. So maybe one needs to avoid the triggers that would tempt one.
Just to interrupt, she's talking about something different. She's saying they make a budget, which is to say this is what they're going to spend this month, and then they don't do anything about it. They ignore it. So they go on about their way, and they pay the bills at the end of the month, but they're not in any way following whether it's the categories they've set up or the tracking device, the tracking, or someone just posted what they need is called youneedabudget.com. I've just started it. It's got lots of help, and it's great.
So, but even again, one would need to, in what way are they not sticking to the budget? Are they spending too much in one category? Or are they just
I don't think they know. I think that's her point. They don't track their spending. Maybe that's the key point.
So a device like an app that would allow you to do that more easily in the moment probably could be a very good thing.
Okay.
So they keep track and know where the money is going.
YouNeedABudget.com. That sounds great. and now someone else writes, You Need a Budget, YNAB, syncs with phones and tablets. So you can look at it as you're in a shop. Wow. That's great. So
the initials are YNAB?
YNAB, YouNeedABudget.com. A number of people are just chiming in and saying this is just a wall. I can't create a budget. I can't follow through with a budget. It's just, budget is just really tough. In terms of breaking down tasks, I think it's a really interesting idea. Do you have any techniques? One person has posted that they find mind mapping a really helpful technique for breaking down tasks. Are there any other tips that you would have?
That can be helpful because you can kind of visualize the components and put them in a sequence. It doesn't need to be a complicated endeavor. It could be breaking down just the amount of time you're going to spend, or breaking down the quantity. It could be breaking down how many pages you're going to read at a given sitting. If you can only concentrate for 20 minutes, okay, well, don't plan to do more than that. I think in general, people with ADHD are better sprinters than marathoners. So find out how long you can work on a particular thing before you get bored, and have a goal And maybe try to prolong it a little if you can. Okay, so let me do 5 more minutes and then I'll stop and take a break. See if you can push yourself just a little. I mean, if you can't, fine. Just make a plan for when you are going to come back to it after your break. That would be important.
Okay. All right. Well, we're finishing up. Lots of posts here on budgeting. People are posting some great ideas. Use cash. Someone else says, I have Mary's book. It's awesome. So, and again, a request to repeat the name of it, the actual name of the book, which is?
So it's Cognitive Behavior Therapy for Adults with ADHD. It's the very last slide, actually, in that, if you can go back to that.
Back up to that slide.
Or it may be either the third from the end, because I had some optional slides in there. It's either I think maybe that's where it is. Yeah.
There it is, yeah. A question, too, as we close, are there support groups for ADD adults? Let me just say to that CHADS, the National Support Organization for ADD, has support groups around the country. Go to their website and see if there's one near you. We also at Attitude Magazine have an online community called addconnect.com where there are lots of people posting with questions and suggestions and supporting each other. And I think if you go online, you'll definitely find some support for managing time for all kinds of things related to ADHD. Well, Mary, thank you so much. This was incredibly helpful, and I thank you all for joining us today. And thank you again, Dr. Mary Solanto.
Thank you.
Bye-bye.
For more Attitude podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.